Hi everyone, I wanted to come on here today with Dr. Jennifer Adams here in Calgary, Alberta. So I'm a breast cancer survivor and I was struggling with lady issues, I guess you can call it. So I came across her and she has what's called the Mona Lisa touch.
Yeah.
So we're gonna touch on that a little bit. I'm gonna ask her some questions and it is who is it for?
Mona Lisa touch is a great treatment for anybody who's dealing with a lot of the symptoms that people have with menopause. So either that's women who are going through menopause in their 50s, late 40s, sometimes those who've had breast cancer treatments who are now menopausal either chemically because they're on a medication to make them menopausal, or they've had their ovaries removed. So with those ladies with a decrease in estrogen, there's a very predictable change that we see in the vagina. So the vagina gets drier, unfortunately. Sometimes people have issues with incontinence, people have issues with painful intercourse, intimacy issues, and that's all fairly predictable. And we don't really talk enough about this. We talk about the hot flashes, we talk about the night sweats, we talk about the mood changes.
But what about this part?
That's right, which get better over time, but we don't talk about vaginal atrophy, which is what it's called. And unfortunately, unless we treat it, it can get worse over time. But the good news is we have lots of ways to treat it, and one of those ways is the Mona Lisa touch.
Yes. So I found Dr. Adams here in Calgary, and I am actually going to get the procedure because I'm 46. I need to take care of that stuff now before it does get worse.
Mm-hmm.
And it is more common than we think. There is a lot of women out there struggling with this and don't know how to deal with it. And also, I think for men as well, if you agree, it may not be you. It may be because your lady is painful and it's uncomfortable and
Absolutely.
she's not talking about it. So if that is a problem and couples can talk, send her to Dr. Adams. She's amazing.
Oh.
Do you want to touch on anything else today so we can share with everybody on it?
Sure. Well, the nice thing, just to talk briefly about the Mona Lisa touch, and the reason why I like it so much is because, it's really great for women who can't be on traditional hormone replacement therapy, which is, for the longest time, for decades, it's been our kind of mainstay for treating what we call vaginal atrophy. So either that's vaginal estrogen or what we call systemic estrogen or traditional hormone replacement therapy. So there's been lots of data and lots of studies, and what it does is it shows that the Mona Lisa touch laser has a very similar effect on the vagina than vaginal estrogen does, which is great. So we know that there's another option out there for women who can't be on hormone replacement therapy or who just choose not to be on hormone replacement therapy.
So like me, my cancer was feeding off my hormones.
That's right.
So this is the next best thing.
Exactly.
Is there anything else besides the Mona Lisa touch that they can do?
Yeah, there's also something called radio frequency, and depending on what other kind of symptoms that you're having, whether it's incontinence or vaginal laxity or things like that, there's various things that we can do, and I do a few different treatments here, and we try to tailor it to your predominant symptoms. There's also something called the O-shot or PRP, which is platelet-rich plasma, which helps a lot with dryness as well. So there's a lot of tools we can choose and we can try depending on what your main issue is and what you're comfortable with.
Awesome. So we're going to touch a little bit on this later. I'm actually getting my procedure done this week, so I will be back with that. As far as like pricing and all that, can they just drop their name, or even if you want to stay confidential, just DM me directly and I will refer you to Dr. Adams.
Absolutely.
Just to keep confidentiality. I know that it is kind of a thing that people might not want to talk about, but I'm here to bring awareness to you, and Dr. Adams has been more than happy to help me out with that. So anything else you want to touch on, or?
I guess I just want to say absolutely, and I'm so grateful for you that you're bringing awareness to this, because to me, it's something that every woman goes through at some point in their lives. This needs to be normalized more, talked about more, because there are ways to treat you and there are ways to help you. And there's, there's no reason to be suffering in silence, because there's people to talk to, there's people to treat you.
Exactly. And how many years do people go with not talking about it? And there's something wrong, but you don't want to speak about it because, yes, it's like, ooh, we don't want to talk about that. So, yes, we're going to talk about it. So, thank you so much, Dr. Adams, and I can't wait. Thursday, guys, we will see you again. And like I said, if you have any questions, please tag somebody in this video, share this video with somebody, or DM me directly. You can find Dr. Adams on Instagram as well as Facebook. And we will talk to you guys soon. Thank you. Thank you, Dr. Adams.
My absolute pleasure. Have a great day.
Bye. That was good.
Nice
Okay,
job.
now